is former national president of the IMA right now. We will continue to get more details while we also while we go to the former IMA national president RV Asokan right now. I appreciate you joining me on the broadcast at the moment, sir. What has been happening across the nation in the wake of such a horrific crime that has come forward, in fact, once again, raising concerns and security on the issues that have been pertaining to the security of women is indeed very unfortunate. What action is the IMA demanding in this case, sir?
We are shocked to our core because the violence on doctors is not a new phenomenon in this country, but this has taken it to an extreme in a workplace. So first about the crime has to be investigated and a proper punishment of highest order should be given to the culprit, and it should be finished in a time frame. And we also want that the factors that have enabled this crime, what are the lack of security measures that doctors are suffering across the country? If this can happen in a medical college and in a metropolitan city, think about doctors in peripheral places, and most of the doctors now are lady doctors taking night work. So I think proper security measures. So these enabling factors have to be first studied, and a mitigation. What are the steps the government as well as the governments across the country are going to take? So these are the three things we would like the governments and the society as a whole, the nation whole, us look at it.
What essentially we understand about this also is the demands that have been made by the Resident Doctors Federation and the students who are sitting on the protest. In your view, should the case also be handed to the CBI for further probe and more inquiry, as it is also parallel to the demands that have been made by the Students' Federation of Doctors?
I think it is up to the family. The Chief Minister herself has taken control of the situation, which is satisfying. And she has also said that the maximum capital punishment should be awarded to if the crime is proved. And the police have been able to identify the culprit within 24 hours. And if the family desires that a CBI probe will be better in this circumstance for the family to decide. And the Chief Minister also has said about fast tracking of the court and expediting. And she has said that the emotion of the doctors is reasonable. I think for the first 24 hours that captures our requirement.
But what is exactly also your view on the kind of inquiry that has happened? Do you suspect there is a deliberate shoddy probe in this matter? Because there are questions, in fact, raised on how the probe has to be conducted, and which seems to be a fair demand by the resident doctors as well, because they suspect that there has been a lapse into conducting and nabbing the real accused.
Yeah. The Chief Minister herself has said that it will be fast-tracked and finished in that is the most you can expect. And we trust that this will happen. But more than the crime also, it's also time to think. It has created a fear factor in the minds of especially lady doctors across the country, where there is absolutely no security in a health center in the periphery. So, it needs a lot more to think, plan, where CCTVs cannot ensure safety. The Chief Minister has provided police camps in all the hospitals. But what about the entire country? The doctors are unsafe. We have been saying that we are unsafe. So this brings to the fore the immediacy or the urgency of the situation.
As you're rightly saying that after such incidents, day and time and again, of course, there is a lingering fear among the women doctors especially, and what we have been hearing from the ground as well, the voices of the women doctors saying that they should be treated with equal security and safety after being also in that position. The safety should be monitored. But what importantly needs to be looked at, Mr. Asokan, that how can a man enter the hospital premises, rape and murder a woman and just leave? There has been a total gross negligence that has happened by the administration of the hospital as well.
Hospital is a public place, and it's difficult. So that is why we have been demanding a 3-layer security in hospitals, and also visiting hours, which are in tune with our Indian culture. Our families stay with the patients. So, it should not impose unnecessary restrictions, but at the same time, reasonable restrictions should have been in place, and availability of restrooms, availability of places to stay for the night, all round presence of staff. I think it involves a lot of things. I do not really want to focus on the particular aspect of the crime, which perhaps the police are the best people to say how this happened, what were the lapses. But one thing is, for whatever may be the general things that we can talk of, it is the local administration of the medical college or any institution for that matter, which will have to work in such cases, see that the safety or security of the doctors are in place.
Also, what is your view on the subject that hospitals are places where women doctors work late? Do you think there should be a total systematic inquiry overhaul after such a brutal incident has come to light?
Has taken us seriously. We've been for the past 10 years, more violent incidents have happened. We have been asking for a central law, at least in statute, which will be a deterrent. And such a law is in place for the airline staff. Somehow the governments are refusing. There are state level laws in 23 states, but they are toothless. They are not being. I think more than the following up the violence, prevention of the violence in workplaces. It's a right of every citizen. Especially doctors are very vulnerable because of their professional nature. They have to be ubiquitous. They have to be present 24/7, and it's a necessity of the today's situation in the hospitals. That safety, security, CCTV cameras have to be in place. Systems have to be in place.
All right, thank you for all these details, and R.V. Asokan for sharing your take on the brutal rape and murder of the trainee doctor in Kolkata.